Physiatrist is a specialist in function in rehab. So basically when we get a patient in our post-surgical unit for rehab or an outpatient center or a skilled nursing facility, the basic job of the physiatrist is to get the person up to their prior level of function. Whether that could be someone who's used to running marathons, who had knee scoped, or it could be an elderly person who had their third stroke.
What I do is I meet the patient. I then do a physical exam of the patient and take their history and then come up with a plan for their rehabilitation. I then talk with the nurses and the therapists about that plan. And on a regular basis, I go to a team meeting with the rehabilitation team. We discuss the patient's progress, and then we get the patient ready for discharge home.
We really focus on the activities of daily living. So, things like you may take for granted, like being able to shower, get in and out of that shower, going up and down stairs, toileting.
They do more than just the pain management. They really help with managing discharge safely to home and the whole clinical outcome. They actually step in and really fill a void that we've identified in this facility.
There's been a lot of changes in rehabilitation practice in the United States in the last 20 years, and where patients might have used to have gone to an inpatient rehabilitation facility or hospital, they're now going to skilled nursing facilities for their rehab. And so physiatrists have followed the patients out into the skilled nursing facility environment.
The model of skilled nursing homes and the whole medical landscape is changing drastically, and they've shown themselves to be nimble, open to these changes, and really actually kind of are in front of the curve as far as that's concerned.
Our company as a whole has taken the position that we want to partner with the best skilled nursing facilities because that's really where the best care is going on.
The type of facilities we really like are going to be outgoing facilities that focus on rehab to home. We want them to be aggressive. We look for 4- and 5-star facilities, aggressive therapy management.
When there's a physiatrist involved in the patient care, it goes smoother. Patients have better outcomes. They go back to the hospital with less frequency. They go home with more frequency, and they have generally lower lengths of stay in rehab.
They spend a lot of time here in the building. They built relationships with our social workers, the therapy team, and they really sit down with us and help the guests and their families kind of understand their goals. And that was something that we were really missing before. I've been thrilled with how quickly the IRC physicians have acclimated themselves to our culture. I really feel like they've partnered themselves with us. They understand what our vision is as far as every facet, including customer service and hospitality, and it's not just straight clinical outcomes. They've really embraced the culture of what we do here and helped us raise it to the next level.